Nemours organization was founded to provide care for children, and the goals of the foundation initially were to provide excellent care, to offer the support of research to complement medical care, and also to train the next generation of providers, residents, medical students, nurses.
We've had a mission at Nemours to improve our quality initiatives throughout the institution, and this has included the Division of Urology. The main focuses are providing the most comprehensive care we can to each child we see, and treating every child as if they're our own child, and also collaborating with all the other divisions and departments throughout the institution.
So I think the thing that's most unique about our division is that we offer extremely personalized and patient-centered care to each of our families. We're very responsive to their needs. We make sure that when they come and see us, that the care they get is as streamlined and as focused as we can make it in order to make their visits easy.
Our different experiences and talents that we have when we come together unify us to solve problems that maybe would have been difficult to solve on our own. This becomes very impactful to our patients, and I believe this will push us towards further innovation as we hear each other to what's needed for the next generation.
Some of the specialty care that we provide as well includes minimally invasive surgeries, including robotic surgery, and pushing that envelope in taking care of each of these kids. Also, we treat a lot of kids with severe voiding dysfunction using modalities such as posterior tibial nerve stimulation or sacral neuromodulation, which are procedures that are not uniformly offered throughout the country. Nemours Enterprise includes a hospital in Wilmington, Delaware, and also in 2 different hospitals down in Florida. We have a very tight relationship with all of the urologists across the enterprise. We meet actually every other week, either for morbidity and mortality conferences and also for interesting case presentations. And so through this collaboration, we have gotten to know each other very well. So we're often meeting with each other to discuss complex patients and leaning on each other for things that we may not have the same expertise as they do. So sacral neuromodulation, the goal was to help provide a resource for families who their child was really struggling with urinary issues and were often dismissed for having an issue that wasn't thought to be important by some. So I started doing this surgery for patients back in 2016 and have taken care of numerous patients. There is something that's so amazing when a family comes to you crying because they're just so joyful that their child is finally able to go to school and urinate like any other child.
I was fortunate enough to train at a facility that exposed me not only to fertility preservation, but to renal transplantation. And I was able to take that experience and bring it home to Nemours. Patients here at Nemours have a very different experience. So they establish their care with us early in life for their management and possible surgery for their urologic conditions. But we continue on with them through the transplant process. And so not only are the urologists a part of their transplant journey and their workup, but me as a urologist will perform the kidney transplant as well. And so that enables their urologic care to be at the forefront and really be optimized throughout their journey. I see our division continuing to become a rising star within our region, able to offer a truly individualized approach to patient care, given all of the treatment modalities and options we have here at the hospital.
I can't say enough good things. I mean, in the process, and since we did this through here, the whole urology team all kind of came together and made sure that we never felt alone in the process, because it is a major surgery. But I could never thank them enough. It totally changed our lives. I would be lost without this team.
In pediatric urology, there are so many questions that we haven't answered. There's been so much that hasn't been researched. We take care of patients often based on anecdotal evidence. And so it's very important moving forward that we start looking at some of these issues in more depth and collaborate with other centers across the country to come up with better solutions. The future of the division has a lot of exciting potential. I'm very thrilled that we now have a research institute called NSOC. It stands for Nemours Surgical Outcomes Center. And that center is helping us build our research program and start answering some of these questions in a more systematic, organized fashion.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.